Can't I just diagnose myself by going to Google? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you are one of our regular listeners, thank you. We appreciate you and are so grateful that you continue to take the time and make the effort to listen to our episodes, our podcasts. And if you're a first-time listener, welcome. And please check out our library of over 350 podcasts.
We're at 375, by the way.
375.
So we're halfway between 350 and 600.
Almost 400.
Or 400, 600? Oh my gosh, I don't know how to add today. I'm just looking into the future, 600
That's
podcasts.
exactly right. I like that.
Yeah.
I like that. That's right. So, Tina.
Yes, Dr. Cruz.
We have a lot of patients that come to us and some of them feel that they already know what's going on because they've done a lot of Googling. Some of them are stressed out because they've done a lot of Googling on the internet. And, we've had this capability, access to the internet for decades now. Mm-hmm. And so I tell you, there's no lack of information. And it's awesome. It's great to have such easy access to information and not have to buy the home encyclopedia set anymore. Right. But it also can come with its anxiety. Mm-hmm. So I don't know. I think this is something that is important for us to talk about. And as far as, when you get a symptom, and right away we look it up. And I do the same thing too. Mm-hmm. I do the same thing. I think everybody does it.
Yeah.
I think that...
And especially during COVID, I think that it got to be more for people to go online because, again, they didn't want to go to the doctor, right?
Yeah, and they wanted to stay out of the ER as much as possible.
Exactly. So I think if people weren't already doing it before COVID, they definitely started doing it during COVID. So there's a lot more people doing it now.
Well, and during COVID is when virtual remote office visits really came into, really became the thing, right? Mm-hmm. I mean, we were also doing that for a while. There were a lot of offices that did that. I know that telemedicine was already out there because I remember looking at a job opportunity that was a telemedicine opportunity probably like a couple years before COVID. Mm-hmm. But it wasn't like the big thing. Now since COVID, it's a big thing, and we even continue to do it on occasion for like more so like for our older patients who for whatever reason it's difficult to get to the office.
Yeah, they live far away. Patients
they live far away. Yeah, but yes, the age of ton of information is here, and so you can easily look up stuff. Mm-hmm. Go on Google. And the thing is that it takes you into a rabbit hole.
Yeah. And there's been a lot of articles that have come out recently about the risk of Dr. Google, which I think is pretty cute how they call it like that. But that's why we wanted to talk about this topic, because there are so many people researching using Google their symptoms, and then there's a lot of repercussions to that. So we just wanted to talk a little bit about the repercussions and the risk of doing that.
So I think that one of the biggest things that could potentially be dangerous, all right, is looking up, all of a sudden you get this headache out of the blue. And let's say you're someone that doesn't typically get a headache, and you get a headache and you get some tingling and your heart starts racing. And instead of calling, 911 or talking to your doctor, you go right away to Google it, okay? And, especially something where it's a very unusual type symptom, okay? Like a very bad headache that you've never had before.
Or a bad stomach pain.
A bad stomach pain.
Yeah.
And, and
it just kind of came out of the blue.
Yeah.
Right? All of a
I mean,
sudden.
how do you know if you may not be having a stroke? Or for the stomach pain, how do you know if you may not be having an episode of acute appendicitis? Okay, which acute appendicitis still could be a very serious, fatal, catastrophic ending, because you could have an appendix that burst and could make you so septic that you could die. That's a reality. That's a reality. I mean, even in today's age, with all the technology we have, absolutely, especially if you've had some abdominal pain that's going on. And I'm not saying that that's for everybody, okay? I mean, I'm not telling you run off and go to the ER,
but the risk is that if you just go to Google for something that could be catastrophic, that you're minimizing really what's happening to you.
Exactly.
Right? And not taking it seriously. And that's the big risk, right? Especially for something catastrophic. I mean, 9 times out of 10, it's not catastrophic, the stuff we're dealing with, but that is a risk, right?
Absolutely.
That you need to be aware of.
And that's why we have emergency rooms, okay? We have emergency rooms so that you can go and get checked out and make sure that there's not something emergent going on.
Yeah, like I remember it was a few years ago, we had just moved into our house, and I had just gotten done with, I don't know if it was with my black belt, my 3rd degree, or with the testing or whatever, and I was getting sharp pains down my arm. I don't know if you remember this.
Yeah.
I was making dinner, and I was super worried that I was having a heart attack, because my dad's dad had a heart attack very young. I mean, he had a lot of other issues, but it runs in the family, right? Heart issues run in the family, and you hear these stories about women who are perfectly healthy, in their mid to late 40s having heart attacks.
Sure.
And so I freaked out, and I looked at you, and I was like, I think we need to go to the emergency room, you know? And so we did, and they ran all these tests, and they said it was just dehydration, stress and anxiety from everything that I had just done recently. And they actually had me do a breathing thing, because I just wasn't getting enough oxygen in my lungs, but like that was scary, right? Like that was a situation where like you don't go to Dr. Google.
Yeah, and even me being a physician, and her looking at me like, I'm like, I'm not going to play doctor with you. We're going, I agree. Let's get to the ER right now.
Yeah.
You don't want to take a chance. Why? It's better to err on the side of caution. And by the way, this is not a push for go to the ER type of podcast. We have no incentive here. We have no, we're just talking about what's happening and things that we hear from our patients. Okay. The other thing is the anxiety that it could,
Once you read what's on Dr. Google.
Yeah, well, the thing is that you open it, you type in something and you get hundreds of things that pop up, okay? Number 1, how credible is everything that's popping up?
Yeah.
Okay? Number 2, it can really get you into a spiraling down of anxiety and fear, and now you're a mess.
Yeah, your stomach pain has turned into cancer at this point.
Right.
And right, exactly. So that's, you keep going down the rabbit hole, and you realize that it could be anything from gas to cancer.
Right.
And that's scary for people,
Sure.
right? They don't know. So yeah, I think that, and then people then Googling every single symptom that they have. It's like the hypochondriac of Googling, right? Which I think there's a name for that, right?
Cyberchondriac.
There you go. It's like hypochondriac, only online.
That's right.
Searching. So that's
Cyberchondriac.
where you build up that anxiety of all the things that you have because you woke up and your eye twitched one time, right? Or you had a loose stool. And all of a sudden you've got cancer, right? Like it's crazy, right? But that's what's happening out there with people, with the anxiety and the fear.
Yep. Yeah. So that's something to be aware of. And, another thing is, which I've seen more of over the past decade with all the information that we have at our fingertips, is patients coming in telling me what they have, and I've always listened to people, no matter what. If they come in, I've had people bring me in articles and I'll read them and everything. But coming in and telling me what they have, and because they're so set that this is what they have because they found all these articles, they're not open to me proposing, you know what, maybe it could be this, maybe it could be that, maybe it could be this.
Or
Okay.
you actually find something else and they're like, nope, that's not it.
Yes.
This is what I have. Like
Yes.
they're so adamant
Yeah.
that's not it. It's this.
Yes.
Which is, again, very risky.
Yes, absolutely.
Not listening to your healthcare professionals, because I don't know, it just seems like a lot of people don't believe healthcare professionals these days as much as they used to. I mean, we used to rely a lot on our doctors to tell us what's going on with our body. And, I mean, there's been a lot of stuff that's happened over the last couple decades, I'm sure, with doctors and people thinking, oh, doctors are just out for the money. They don't really care about us. Most doctors out there do care. That's why they're doing this job. I
Right.
mean, yes, there are those out there, here and there, but for the most part, doctors care and they want to find out what's wrong with you and they want to help you. But a lot of people are skeptical.
Sure.
Right? And so they think they know, and then their doctor says, no, it's this, and they don't want to believe them.
Yeah.
That's also very risky.
Yeah. And that's, I mean, fortunately, it's not something that I've had to deal with a ton of. But through the years, I have had that occur where they come in, and if I didn't, basically, once I did my workup on them, which might include procedures, CT, or whatever, if my conclusions didn't meet, what
Their
they expectation was, what they thought it was, I've had some patients leave the practice, be like, I'm going to go somewhere else, which is fine. I mean, I've always been like, hey, go get another opinion.
Or you get into an argument with them, which is not what you want to do with your patient about what's going on.
Well, yeah, I've had some question me, well, are you sure? How could that be that you didn't find this? I'm like, I'm sorry. I'm sorry that I didn't find what you wanted me to find in your stomach. I mean, but I can't make this up. I'm not making it up. And so anyways, these are just some of the concerns and the dangers.
The other concern with medicines, because there's so many over-the-counter medicines
Oh,
for things
yes.
now, right?
Yes,
so
yes, yes.
You self-diagnose using Dr. Google, then you go get an over-the-counter medicine.
Yep.
Now you're taking something maybe that you shouldn't be on that causes something else. Now you're actually in the doctor's office and they've got to give you medicine to reverse. So there's a lot of money being spent on medicines that you shouldn't be taking, medicines that may hurt you, and you don't realize it, and now we've got to counter that. So just a lot of time and money wasted on using Dr. Google.
Yes.
Right. So that's
and here's the thing, like a great example is somebody who goes, as far as the medicines, the concern with medicines and people now self-diagnosing and self-medicating, okay, is maybe they're having some indigestion, some reflux. They buy some over-the-counter Prilosec. They start taking it. Now the box has a disclaimer, I believe, and says, don't take this for more than 2 weeks or whatever. I know because patients have told me about it. I haven't actually looked at those boxes, but that's because they want to make sure that you're going to see someone and not just keep taking this forever. Because what if your indigestion is because you've got a tumor sitting in your stomach? Okay? I mean, you're not really going to have really, really serious symptoms as far as a tumor in the stomach until it's really big, because the stomach is a big sac. And so you can have something growing there for a long time and not know it, until it's so big that now it's causing you issues. Okay, so that is a big concern. The self-medicating and then just taking something indefinitely and never going to get it checked out. So.
Anyway, be careful with Dr.
Yeah,
Google.
be careful. Be careful.
Go
I mean,
see your doctors.
Yes.
If you don't trust your doctor, find a different doctor,
absolutely,
one that you can trust.
Absolutely.
And get behind and because there's a lot of doctors out there that have your best interests in mind, and they want to help you get well with the right medicines and the right treatments and the right procedures and so on and so forth. So find those doctors if you don't have them.
All right. Well, thank you so much for joining us. And Please, if you want to connect with us, please check us out. Go to our website, drlizcruz.com. You can click the magenta button on the homepage and schedule a free 30-minute wellness consult. And that can be done from anywhere because it's done over the phone. So please check us out. If you haven't rated our podcast, please give us a rating of 5 because that'll help other people like you to find us. And lastly, if you haven't subscribed, what are you waiting for? Subscribe to our podcast. That way you will never miss an episode. All right. Take care and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.